COVID-19 is no longer a public health emergency of international concern. So says the World Health Organization, which believes countries can now manage the virus independently, along with other infectious diseases. WHO Director General Tedros Ghebreyesus says the pandemic has been on a downward trend for more than a year now. But South African health officials are urging us to remain vigilant, warning that the novel coronavirus is still spreading. Let's speak now to Professor Adrian Puren from the National Institute for Communicable Diseases. Prof, thank you so much for joining us. This WHO decision, it just seems so late to be hearing this, because for most of us, it feels like this is now a fairly innocuous form of flu. Most people have immunity. What has happened that they've decided this is the moment to declare that it is no longer an emergency?
Well, as you said, I think at least for South Africa, I think that we've adapted, if you like, to made that transition in terms of the numbers, and I think the decision is a really difficult one for WHO because it has to consider the fact that it had declared the fear, as it's called, as a global requirement. And so I think making those decisions, I think, becomes somewhat complex and difficult, I think, from the WHO perspective. I think it's easier from a country perspective, given the fact that the current rates of infections are fairly low. And we have high immunity. We don't have the vaccine rates, I guess, that we would like to have seen. But in terms of hospitalizations and deaths, certainly we have adapted and have low levels of hospitalizations and death. But I think from the WHO perspective, I think it was key because that was the instrument that they had for a global response. And I suppose they've realized that, yes, certainly when they've started to look at their particular data, that in terms of the death rates and so forth, the rates of vaccination, hospitalizations, that this could possibly be the period. But it's really what they're declaring is that the emergency is over and that we need to now move into a transitional phase. And in fact, the WHO has come up with a plan for that particular transition for us to, again, address certain of the concerns that there are. So the pandemic is not over because we certainly have ongoing circulation. It's not behaving like influenza or flu because there's no seasonality to it as yet. There's just ongoing transmission as we currently are seeing. So it's behaving differently, and therefore I think it's really key in this transition phase to be ready and address any of the particular questions or challenges that we may still continue to have or will still continue to have. Yes.
Yeah. You make an important point that it's not acting like a normal flu, because in my mind, it's right up there with a flu. And, flu, you can have your yearly flu jab if you want. You said that there's a plan that the WHO has for this transitional phase, and I was wondering how that plan compares to what local health officials are suggesting. I mean, we've been told that we should still take the vaccine rather. What are the plans?
Absolutely.
Do they dovetail?
Yes, I think that they do, because I think WHO certainly gives guidance to the various states that are involved, and therefore these plans are really a reflection of what they call the after-action reviews in countries. What went well, what didn't go well, what are the remaining challenges for us to make this transition to manage the long term of this particular infection. So certainly it does match that in the sense of, for example, access to vaccines. So I think we should still continue to encourage especially particular high-risk groups, whether that be in the older age groups, those with comorbidities, pregnant women, for example, healthcare workers, to be vaccinated as well. And then there's the focus on our community. So communication is really going to be central, and communication is really key in terms of what do we understand, what our communities or their responses saying about COVID-19, especially as you know, our vaccine uptake has not really been great, but are there opportunities for us to continue and to encourage people to take vaccines or to be vaccinated? Making access to vaccines is really going to be key as well there. And then when you think about responses at the hospital level, for example, again, we certainly made certain advances, for example, access to oxygen, to beds, for example, and those sort of things need to be there in place. And we shouldn't become nonchalant about the fact that there's COVID, but we're not being overwhelmed. But because, again, the virus could change. And again, that's an important critical component of this particular plan is really our surveillance systems. Our surveillance systems should give us an idea of what is the burden of disease, who's being infected, are those individuals who are ending up in our wards the vaccinated groups now as opposed to the earliest phases? So these are the types of questions that we need to answer. Again, the variants, as you know, that was one of our big triumphs, was really setting up the networks within South Africa to identify the virus, to know what the variants are in circulation. That's going to be a very important component as well in order to inform as to how we go along with this particular virus. It's really that transition. There are different components to it, as I've tried to indicate, and it's trying to get all that to work together or for us to, as we transition to COVID not disappearing, how do we manage this in the long term?
It was quite interesting recently. Half my family got sick, and my one child was given a test, a swab, but it was testing not just for influenza, not just for COVID, but also for RSV, which I understand is respiratory syncytial virus. Talk to me about RSV, the different types of viruses in circulation, and how extremely are people presenting with bad viral and bacterial infections. Is it still worse? I know after all the COVID regulations were withdrawn, a lot of people got really sick quite quickly. Are we still seeing a more extreme burden of viral bacterial infections?
So in terms of, I can't really talk about the bacterial ones as such, but certainly the RSV, or residual syncytial virus, is in circulation. In fact, previously, and I think this is a result of all the factors that prevented circulation of SARS-CoV, or attempts to prevent SARS-CoV in circulation, such as, for example, the wearing of masks, social distancing, and so forth. We didn't really have an RSV season for a year or so, and yet now that we've relaxed, and in fact, because of the low levels of SARS-CoV-2, we actually are seeing a season. In fact, we have seen a season of RSV. The numbers are certainly declining. It does not appear to be in terms of severity, much markedly, as far as I'm aware, different from any other particular season that we've certainly had. But certainly it is there. And I think we still need to be aware and protect our children in particular, and high-risk groups. Yeah. In terms of influenza, so again, we're starting to see an increase in the numbers of cases. And so again, there's an opportunity for us here, again, to, given our experiences, and given the fact that we, in fact, also did not have flu seasons as such, there are opportunities, for example, vaccination. So again, high-risk groups, especially in the older age groups, in terms of influenza, pregnant women, those with cardiac and other comorbidities. This is an opportune time, again, to learn the lessons. In other words, have an integrated approach. I like the way which you said that they had now an integrated approach. What is causing the symptoms and signs in your child? And so there are opportunities to improve lab diagnostics, improve access to influenza vaccines and so forth, which are all really critical and important.
And I suppose it speaks very much to what you were saying about constant vigilance, just to make sure nothing new is developing, nothing is mutating. You know,
Absolutely.
It is easy to forget now that we're through it, that nearly 7 million people died worldwide of
Absolutely.
COVID. Every night on this program, we used to give these grim figures of hospitalizations and deaths. Talk to me about hospitalization rates for COVID, daily deaths for COVID. I know that you don't officially monitor it, but is it on a par with your typical influenza? Give us a sense of what those figures look like.
Yeah, so again, I don't have all the figures at hand because, as you said, we're not monitoring it to the extent that we usually have. But there is some evidence that there are fairly low, substantial rates of hospitalizations and deaths. They certainly are occurring. Again, it would be helpful for us to understand who those individuals are to get a sense of whether or not we do expect, in terms of those individuals who are reaching our hospitals, are probably vaccinated as well, possibly. But in essence, and they're probably in the older age groups as well. So that's probably where we are seeing our main morbidities and mortalities are really in the older age groups, as well as those, I suspect, individuals who have, for example, comorbidities such as hypertension and diabetes, for example, as good examples. But the levels are fairly substantially lower. I think we will get a better sense over the next year or so of what that burden is, because we are trying to collect that type of data. We don't really collect it in terms of influenza, for example. Many of the data figures that we have for influenza are really modeled. So it's very interesting, again, to see that here with COVID-19, we've invested a great deal of time and effort to actually measure the actual numbers as such. So I think we will get a better sense of whether or not the morbidities that we're seeing and the mortalities that we're seeing are equivalent to what we're seeing with influenza. But as I wanted to again stress that in fact we're not seeing that sharp peak of a few months as we do with influenza. We're just seeing continuous numbers going through the system, if you like, with regard to COVID-19 compared to influenza.
The emergency, the global health emergency, may be over officially, according to WHO, but the pandemic continues. Most of us had immunity, and you make the point that vulnerable people need to keep having those boosters and also those flu jabs as we get into winter, particularly because we do have a winter flu season. Thank you so much, Professor Adrian Puren from the National Institute for Communicable Diseases.